Good afternoon. My name is Duran Season, your manual therapist for this afternoon. So I am with me, Miss Jinky Montemayor. He's my buddy for today. And to start with the MFR video case study, I'm going to start with looking for body reading. I'm checking the posture of my client, looking at the front, back, to her right, and to her left. I'm looking for elevated shoulder, side bending, and also uh, the ear level. Then from there, I'm going to ask the client now to start my snort test. So that's standing. So I want you to face the wall for me on that side. Okay. And now to face here a little bit. Thank you. So for this test, snort test on a standing, so I'm going to landmark the PSIS. There you go. And I'm going to put my right finger on the PSIS and my left thumb, my right thumb on the PSIS and my left thumb on and sacral 2. And I'm going to ask the client to raise her right leg, okay, or flex the hip, okay, bring it down. So there's some imbalance there, but the PSIS moves inferiorly. Now I'm going to put now my right thumb on S2 because I'm going to do it on the left side, and my left thumb on the left PSIS, and I'm going to ask her to bring up the left leg or flex the hip. Okay. There's some kind of imbalance there, but there is like a slight movement of the PSIS going down. Okay, thank you. Bring your legs down. And now I'm going to ask the client next now. I'm going to repeat the same procedure, but I'm going to ask her to abduct both of her arm up, or bring your both arms up for me, please. Okay. Now I'm going to locate again on my right thumb, PSIS, and my left on sacral 2, and do the same thing. Bring your flex your right hip for me. Okay, thank you. And also placing my right thumb on S2 and my left thumb on PSIS, and ask the same procedure to bring up. Okay, thank you. So with the snort test, okay, relax your arm now, bring it down. I'm looking for ease of movement of the PSIS inferiorly. So I just repeat the steps with my client arm, and done it on both sides. So I'm looking, just making a note, the side that doesn't move inferiorly. Now, next, I'm going to ask my client now to lay supine on the table. So that is laying on her back, head here. Okay, face the ceiling for me. Thank you. So I'm going to do the CCP for a diaphragm or common compensatory pattern. So I'm going to bring your head up a little bit. Okay, on the line. Okay, thank you. So I'm going to start with Atlanto-occipital. So I'm going to tap her head, behind her head, looking for the occipitals, and then I'm going to do a full cervical flexion. Yep. Looking to lock the cervical cervical line. Now I'm going to do a rotation to the left and rotation to the right. Again, I am looking for ease of movement on the left and right, and making a note which side is more ease. After that, I'm going to move now on the cervical thoracic. So I'm going to bring both of my hand behind the scapula. Okay, I'm the one going to do the movement. So I'm going to place my hand under the scapula, and I'm going to lift the left side, going to the right, looking for ease between the two, and I'm going to do the same thing, lift my right hand under the scapula, going to the left. In this case, I find the right side with ease. So I'm also checking for which side is easier. Okay, and now I'm going to do next now is the lumbar sacral. So I know I still have to go to the hand under the scapula and respiratory, hands on the lower rib from 7 to 10. So I'm going to bring my arms rib 10 to 10. Okay, and I'm going to rotate to the left and rotate to the right, looking which side is ease. Okay, thank you. Now I'm going to place my hand on the pelvis and ASIS. Okay, and I'm going to rotate to the right and rotate to the left. Okay, I'm also the same thing. I'm looking for ease of movement on the left or on the right. So on this condition, the right side feels a little easier, so I have to take note of that. And from here, I'm now going to move to rib cage movement. So in the same thing, supine, because I'd like to look for the breathing, analyze the breathing. So on the supine, I'm going to palpate the lower rib. Okay, and I'm going to ask the client to take a deep breath. Okay, thank you, and one more. Okay, so I'm looking for the balloon-like feeling on both sides during inhaling, breathing in and breathing out. Okay, it's like looking for superior lateral movement, on exhalation during ascending and descending. And now I'm going to move now to the upper rib. So I'm going to palpate the ribs. Okay, feeling for movement during exhalation. Okay, breathe in and breathe out. Okay, so one more, breathe in, breathe out. Okay, so in this position, when I'm looking for also the ascending, descending, and I am looking for the movement during exhalation for the superior, anterior. Okay, and next I'm going to palpate both sides, one hand on the upper rib and my other hand on the lower rib. So I'm going to go to the upper rib and the lower rib. Okay, And I'm going to ask her to take a deep breath. Inhale, exhale on both sides actually. And the same thing, I am looking for the inferior expansion on each side. And I'm going to do the same thing on the right side. Upward and lower, and take a deep breath. Feeling the balloon like. Okay, one more. Okay, thank you. Now after that, I did it on the both side. I'm going now to move on to the next on this will be the pelvic diaphragm. So in pelvic, it's the same thing, prone. So I'd like you to turn over, please. On this side, can you turn over and your head on that side for me, please? Lay on your belly. Belly on your belly. Lay on your belly. Yeah, you lay on your belly, and you have to slide down for me, please. One more. Okay, thank you. So this is also a pelvic diaphragm. So on the prone position, I'm going to have both of my hands resting on the glutes. Okay, this way. Okay, it's between the glutes and the coccyx. On the glutes, it's between coccyx and ischial. Yeah. Okay, I'd like also to take a deep breath. Yeah. I'm looking for balloon-like movement on both sides. It should be equal. Okay, thank you. And now I'm going to do a sacral rock, one hand on the sacrum. I'm going to do this, I'm going to feel the movement for nutation and counter nutation, and I'm going to put my hand on the sacrum. Okay, sacral rock on hand, feeling for the movement. Take a deep breath. Yes, I'm assessing the quality of movement. I just have my hand relaxed on the sacrum, feeling for nutation and counter nutation. That is when inhale it's counter and exhale nutation. Okay, so I'm assessing the sacral rack for counter nutation and nutation. That's the pelvic diaphragm on the prone position. Now I am moving now to the treatment of glute max. So I have my one hand on the glutes. So it's just closer to lateral side of the PSIS. This one here, okay, lateral. And this is on contralateral. So my other hand on the door. Yeah, I'm going to put my other hand on the latissimo dorsi. Okay, take a deep breath. Okay. I am grasping the glutes using my thumb or flat fingers, hand in the border. Okay. Glute max. And now I'm going to do the FC lateral. Okay. My other hand on the latissimo dorsi. Okay. That's the glute max. Now I'm going to do next is the glute shaping. So I'm going to have my client to do like a frog-like style. So I'm going to bring this way. Okay. Bring this down. Okay, thank you. Okay, on this side, so it's like a long lever. I'm going to use my hand on the border and glutes and grasp it using my thumb or flat one hand in the glutes, and one hand on the side. So I'm like torsioning or lifting the glutes away from the sacrum. Yeah, yeah, fully with my lever, one hand in the glutes. Yeah, waiting for ease of the muscle or feather feather barrier or ease of the muscle on the ischial. Okay, and now I can also do the long lever. So I'm going to have my client flex the knee, okay, and my one hand on the glutes, okay. Then I can perform abduction and abduction, okay. Waiting for the feather barrier again or softening of the tissue, and I can also extend the hips. Extend the hips this way, and I can also do the same thing, the adduction and abduction, and looking for the feather barrier or softening of the tissue. So this is my presentation for our P2Ks for the MFR treatment. Thank you and have a wonderful day to everyone.